I'm Larry Farver, and let's queer up health. Trump administration ends direct CDC HIV grants, shifts $46 million to states. The Trump administration has ended a long-running federal grant program that directly funded local organizations providing HIV prevention and care services, redirecting the $46 million through state health agencies instead. The Centers for Disease Control and Prevention's community grant program currently supports about 96 organizations that provide HIV testing, referrals to care, PrEP, doxy-PEP, and outbreak response. Under the change, states will determine whether those organizations continue receiving funding. However, AIDS United, a Washington, D.C. based nonprofit, criticized the decision. CEO Carl Bologna of AIDS United warned that the potential impact, quote, "We cannot end the HIV epidemic by dismantling the trusted community systems that make prevention possible. This decision threatens access to testing, PrEP, PEP, and care, and will ultimately lead to preventable HIV transmissions, program closures, and higher healthcare costs," end quote. Advocates also expressed concern that some states might not prioritize funding from community-based organizations serving populations disproportionately affected by HIV, including Black and Latino communities, LGBTQ+ people, and people in the South. Carl Schmid, executive director of the HIV+ Hepatitis Policy Institute, said funding decisions could vary widely by state, potentially delaying support for local organizations and limiting access to discounted medications tied to the federal grant program. Well, there is so much that we have to look at with this November's voting, especially here in Florida and many other states like Florida. It's frightening and challenging to think that many of our fine nonprofits here could be impacted, and what that would mean for our community. What do you all think?
I mean, we keep seeing that the federal government's pushing it to the states and pushing it to the states. I'm wondering when it's going to be, you're going to see mass exoduses of people out of certain states. Because, I mean, you're already seeing it with abortions. You're already seeing it with gender-affirming care, that people are leaving their local areas, their states, to get the care that they need in another state. And then we're seeing people being witch hunted, and the doctors being witch hunted from the states that don't do the care for the states that do the care. And so now this is yet another situation where the government's going, okay, back to the states. This is what you've been wanting, so here you go. And now that money is going to sit there, and the state's going to go, we're going to put it in something else.
Exactly.
If you're lucky.
And I mean,
just something else. A new swimming pool at Governor's Mansion.
Well, no, my point is actually like the Trump administration, this is not in a vacuum with how they've treated HIV and healthcare funding overall. I was reading in Vox last week about how the future of HIV vaccines, and there was one of the scientists they were talking to. They were just getting ready to do an actual trial of an HIV mRNA vaccine. They had gone to Africa to start it, rolling out. As soon as they touched down, like a week or two later, Elon Musk and all the Doge people, they cut all the funding. Literally collapse the entire research project. We've been seeing these stories about HIV with this particular administration since he started. With this one, it's horrendous what could happen to people. This follows so many other problems with him doing all this. And also, we were talking about how this will affect people's prescription drugs. He's not just coming for people with HIV's prescription drugs, people. They want to get rid of Medicaid Part D, the prescription expansion. So any of you older people that voted for Trump, good luck. Good luck paying for your drugs, kids. That's what we're into right now.
And also to the point that White House don't only give these money to the states when the states agree with them, right? There's a recent report that at least 4 FEMA requests approved by FEMA, his FEMA, was denied from White House, from the Oval Office, because they're blue states.
Right.
They are withdrawing money from blue states to punish blue states while giving red states governments essentially free money to base and to use ostensibly for other users, but it's going to end up benefiting only the people who voted red.
Correct.
That's it is a fundamentally government by favoritism. This is not government by equality or even equity. This is government by I like you and therefore you get more money.
Right.
I don't like you and therefore when you have a wildfire, I'm not giving you a cent to combat it.
Correct. And the problem is in 2 years' time, when we can actually try to do something about it, many of these nonprofits and organizations that give this care will have closed and folded, and to restart something is lengthy at best. So the damage that it will do, not that it could do, that it will do, might not ever be.
Rex is touching on to one of the problems that a lot of activists get worried about, the concept of electoralism. And it's, one side can destroy so much and it takes so long to try and rebuild that you never actually get back to it. Correct. And it's a huge problem with American democracy right now, where it's like, if we don't fix it, I don't know how this country's staying together.
It takes a month to take down an agency by Doge. The problem is that, to rebuild it, it takes 10 years.
Yeah.
But the electoral problem is this. People expect it to go back up in a month. When Obama came into office, everyone is like, oh, you must fix everything that Bush did wrong. And if you did not do it immediately, then you're a failure. That's how we come up with, and of course, you also get enormous sabotage from bad actors like the Tea Party. They try to.
Who was that guy Mitch something? I think he might still be alive. Didn't he say his entire...
I don't know, it's a Schrodinger's Mitch McConnell at the moment. He can be alive and not alive at the same time.
Do you remember he said on day one it was to destroy Obama's presidency?
Well, at the same time, the right is allowing someone like a Pete Hegseth to request millions of dollars to continue the war in Iran, no matter what you think about the war. Also to provide testosterone to the military at this time optionally.
It's gender-affirming care.
Of course, thank you.
Right.
It's almost like being in a cartoon in the world that we're living in right now.
I mean, just if everybody think about this. Think about your car, right? Your car works. It takes 1 second for it to die. And you take it to the shop and they say it's going to take a week. So use that analogy to think about all of our organizations out there. Our organizations that, not just in HIV, but in everything that we're doing, gender affirming care and abortion clinics, when something closes and something dies, it takes longer for it to open. And because of our democracy and things changing every 4 years, maybe 8 years, by the time we get the ball rolling, something else comes in. So we need to prevent these things from closing. We need to prevent these organizations from failing to give care, because what's going to happen is it's then going to fall on our hospitals and ERs. And so then those places who say, okay, we can't refuse you care, are going to then pick up the slack, and then where are those bills going? And your insurance rates, we're already complaining about insurance rates. It's not a micro situation, people. We are a global economy, and it affects global concerns, and it affects us globally, period.
Exactly. And, to echo Larry's point about how much they're spending on that war, it just reminds you that if the government ever tells you they have no money for something, they do. And that's an important note. And there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.